Celiac disease is an autoimmune disorder that affects a significant portion of the global population, yet it remains shrouded in misunderstanding and misinformation. Known for its complex and often subtle symptoms, celiac disease occurs in individuals who are genetically predisposed to gluten, a protein found in wheat, barley, and rye. When these individuals consume gluten, their immune systems react by damaging the lining of the small intestine, a delicate, tightly coiled organ responsible for nutrient absorption. This essay aims to explore the nature of celiac disease, its symptoms, diagnosis, impact on individuals' lives, and the available management strategies. At its core, celiac disease is an autoimmune response triggered by the ingestion of gluten, which leads to inflammation and atrophy of the villi in the small intestine. These tiny, finger-like projections increase the surface area for absorption. This damage hinders the absorption of essential nutrients such as vitamins, minerals, proteins, and fats, ultimately resulting in various health complications. The hallmark of celiac disease is a genetic predisposition. Most individuals with celiac disease carry specific genes known as HLA-DQ2 or HLA-DQ8. However, possessing these genes does not guarantee that one will develop the disease, as environmental factors also play a significant role in its progression. Symptoms of celiac disease can be incredibly diverse and vary widely from person to person. Often, these symptoms can be vague and easily mistaken for other gastrointestinal disorders, leading to a misdiagnosis in many cases. Common symptoms include abdominal pain, bloating, diarrhea, and weight loss as the body struggles to absorb nutrients adequately. However, patients may also experience non-gastrointestinal symptoms such as fatigue, joint pain, skin rashes like dermatitis herpetiformis, and neurological issues like brain fog, headaches, and mood swings. The wide-ranging symptoms reflect the intricate ways in which celiac disease can impact overall health, making it essential to recognize the condition in its many forms. Diagnosing celiac disease can be a complex and multifaceted process since it shares symptoms with numerous other gastrointestinal conditions such as irritable bowel syndrome and Crohn's disease. Medical practitioners typically begin with a thorough medical history and physical examination. The diagnosis is commonly confirmed through a combination of serological tests that measure specific antibodies in the blood, such as tissue transglutaminase antibodies or TDG-IgA. Following a positive serology, an endoscopy may be performed to obtain a biopsy of the small intestine, providing definitive evidence of the villus atrophy characteristic of celiac disease. Once diagnosed, the implications of celiac disease can be profound. Individuals with celiac disease must adopt a strict, lifelong gluten-free diet, avoiding foods that contain wheat, barley, and rye. This dietary restriction can create significant challenges, especially in a world where gluten is prevalent in many processed foods and dining options. Celebrations, social gatherings, and even daily meals can become sources of anxiety for those with celiac disease as they navigate the complexities of food preparation and restaurant dining. Moreover, maintaining a gluten-free lifestyle often requires extensive education about food labels, cross-contamination, and safe cooking practices, as even minute amounts of gluten can trigger adverse reactions. The impact of celiac disease extends beyond dietary restrictions. It can also significantly affect emotional and mental health. The social burden of celiac disease can lead to feelings of isolation, uncertainty, and frustration. Studies have indicated that individuals with celiac disease are at an increased risk of developing anxiety and depression, stemming from both the physical ramifications of the disease and the social stigma attached to dietary restrictions. Support groups and educational resources can play a crucial role in helping individuals navigate these emotional challenges, creating a sense of community and understanding among those affected. Beyond dietary management, individuals with celiac disease are often vigilant about their overall health and well-being. Regular follow-up appointments with healthcare providers are essential to monitor for nutritional deficiencies, as deficiencies in iron, calcium, vitamin D, and folate commonly occur due to malabsorption in the intestines. In some cases, additional supplementation may be necessary to address these deficiencies. Furthermore, the risk of developing other associated conditions, such as osteoporosis, infertility, and certain types of cancer, especially intestinal lymphoma, necessitates ongoing medical supervision. The increasing prevalence of celiac disease in recent years has prompted research into its etiology and potential therapies. While a gluten-free diet remains the only effective treatment for managing celiac disease, ongoing research is exploring alternative therapeutic approaches. These include enzyme therapies that may help break down gluten in the digestive system, immunomodulatory therapies that aim to suppress the abnormal immune response, and even the possibility of a vaccine to induce tolerance to gluten. Although these advancements hold promise, they are still in the experimental stages and require further investigation before becoming standard practice. Awareness and education about celiac disease are crucial in improving diagnosis rates and the quality of life for those affected. Many individuals remain undiagnosed due to a lack of awareness about the disease or its symptoms. Greater public understanding can lead to earlier diagnoses, allowing patients to implement dietary changes sooner and avoid severe health complications associated with prolonged exposure to gluten. Society as a whole has a significant role to play in supporting those with celiac disease. Restaurants and food manufacturers are increasingly becoming aware of the demand for gluten-free options, leading to the development of a broader range of gluten-free products. However, it remains essential for establishments to adhere strictly to gluten-free protocols to prevent cross-contamination. Consumer advocacy groups can help raise awareness among food providers about the importance of serving safe and adequately labeled gluten-free options, thereby ensuring diners feel secure about their food choices. In conclusion, celiac disease is a complex and often misunderstood condition that poses significant challenges for those affected. The autoimmune response triggered by gluten consumption can lead to severe long-term health consequences if left undiagnosed and untreated. It is imperative to foster awareness and understanding of celiac disease, not just among those who suffer from it, but within the general public and healthcare community. Until then, individuals with celiac disease will continue to navigate their path with resilience, adapting to a life that demands constant vigilance in the face of an invisible enemy.